Hello, Tanisha. I'm Chloe. I'm going to be your nurse during this wellness exam visit. I'm going to do a head-to-toe assessment on you here. Right now, for visual appearance, you look well-nourished, you don't appear overweight, you look pretty healthy, not in any distress or in any pain right now. So your skin is also within your ethnicity limits as far as color, and it is dry, not clammy or anything, so that is good. I'm going to palpate your scalp. We're going to start with that. And I am looking for any lesions, any bumps, making sure everything's symmetric. Good. I'm going to look at your scalp a little bit here. Look at your hair. Looks well nourished. It's not breaking off or anything. I'm looking at your face now. I'm looking for symmetry. There's no scarring. There's no trauma to it. I'm now going to palpate your sinuses. Let me know if you feel any tenderness or pain.
No pain, no tenderness.
Good. I'm going to go down and feel for your lymph nodes here, down your chin. Good. I'm going to go above your clavicle. And that circular palpation motion. Any tenderness or pain?
No.
I'm also going to kind of feel along your joints here since I'm up there. I'm going to feel your temporal pulse. Very good. I'm going to assess your TMJ here. Go ahead and open your mouth. Good, and close. No clicking, symmetrical movement there. I'm going to look at your eyes. Very nice white sclera, which is good. Pull down here, and the lining there is nice and pink, so that is good. We're going to do some facial exercises just to assess your facial strength and symmetry. Go ahead and lift your eyebrows. Okay, smile, frown, show your teeth, puff up your cheeks. Very good. I am going to have you do some neck range of motion. Go ahead and rotate. Good, and flex your neck, or extend and then flex your neck, and then take your ear and try to touch it to your shoulder. Very good. Push on my hand, and one more time back there. Very, very good. I'm gonna look at your pupils here. I'm going to directly put the light there, looking for that reflex in that left eye, and then I'm gonna look for the pupillary constriction in that other eye as I shine that light. So, direct and consensual pupil reflexes are good. Go ahead and follow my finger with your eyes and not your head. We're doing the 6 cardinal fields of gaze. This is assessing your extraocular muscles and movements. One more down there, good, and keep following my, good. And as her eyes cross, her pupils constrict, which is a normal reflex. I'm going to have you assess, I'm going to assess your peripheral vision. Just tell me when you can see my fingers.
Yes. I see him.
Good. I'm going to take my ophthalmoscope and look inside your eye here. I'm going to have you look straight ahead. I'm going to turn on my light and my dilator, and I can focus it to make blurry visions sharper. So I'm going to find that red reflex first. I'm just going to kind of touch you so I don't bump noses with you, and I'm going to slowly come in, adjusting accordingly, making sure I see your structures. I can see your vessels and your fundus, which is distinct in shape, so that is a normal eye there. And it's pink orange in color, which is also normal. And then I would repeat on the same side, just switching my eye for that eye. I'm going to look at your ears now. I'm going to grab my otoscope. And I'm going to do a quick tug test to see if there's any pain before I put an instrument in your ear. Any pain there? Good. What I'm doing, I'm just pulling the pin up and back to see if there's any irritation. I'm gonna turn my light on. I'm going to go through your external canal, very good, and I'm looking at your tympanic membrane, which should be a nice pearly white color, which is good. I don't see any obstructions or over buildup of wax or anything in your ear, so that is good. I would repeat on the other side and compare. I'm going to do what's called a whisper test. I'm going to occlude your ear, and I'm going to say a common 2-syllable word, and I just want you to repeat it back to me.
Apple.
Baseball.
Baseball.
Perfect. I'm going to look at your nose now. Go ahead and tilt back. I'm just going to lift up there. I'm going to shine my otoscope in there. Looking at the nares, I don't see any drainage on the outside or any redness, and your septum is not deviated. I see the mucosa there and the turbinates. And those are all within normal color, nice pink color, not too red. Any pain or anything assessing that.
No pain.
Go ahead and open up your, I'm just gonna change out my cap. Because I think that's gross going from the nose. I should have gone. Anyway, open, say ah.
Ah.
I see your uvula go in movement with that. I'm looking at your tonsils. I don't see anything, any swelling or drainage. I'm gonna grab my gloves here. Take my tongue depressor and my otoscope and go ahead and say ah. Sorry, let me switch. Okay. Good. I'm also looking at your dentition. No loose teeth or obvious cavities. Very good. Go ahead and stick your tongue out. Good. And then tie the tie. Good. I want you to push your tongue. Go ahead and stick it out a little bit and push on that stick. Give me some resistance. Good. Other side. Good. Push down. Good. I already did your Team J. Team J, did your Team J. Alright, clench. Did I do that already? So, yes, I want you to keep your mouth closed. Very good. Did that. I can also, I'm not really gonna do it, but to elicit the gag reflex, I would have you open your mouth and I would lightly poke the back of your throat and see if that would initiate the gag reflex there. I already assessed your lymph nodes here. Everything was symmetrical. I'm gonna feel for your carotid pulse. I'm not gonna do both at the same time because that can cause fainting, and that's just not good. I don't feel any trills. I'm going to auscultate your carotid pulse to listen for any bruits. I'm gonna listen for that. Good pulse. Very good. Also, I don't see any jugular vein distension from this angle. Now we are going to go to the lungs, so I'm going to have you flip. And then I'm inspecting your symmetry and your rate of breathing, and your skin and everything is at an appropriate color and rate. I'm going to assess your chest expansion. Go ahead and inhale. Good. Everything's moving at a symmetrical on my hand. So I'm going to auscultate your lung fields. Every time I move my stethoscope, I just want you to take a deep breath there. I'm listening for a full breath and noting, going side to side, assessing for that symmetry, making sure to get those lateral fields in that right middle lung lobe. Very good. I'm going to do what's called tactile fremitus assessment. I'm just going to put my palm to the back of your hand, and I just want you to say 99. Whenever I move it.
99.
That's assessing for
99.
Vibrations,
99.
which I am feeling.
99.
So there isn't any
99.
consolidation or anything in your
99.
lungs.
99.
Avoiding that
99.
scapula.
99.
Very good. I'm going to percuss along your back here, making sure to go in between the ribs. I want that nice resonant sound between them in the intercostal area. Also, I see your spinal processes and the ones going from the T4 are aligned with the rib number. So that is appropriate. Go ahead and flip around for me. I'm just gonna do the same thing to this side. I'm going to expect visual symmetry and color and distress and rate. I'm gonna do that chest expansion test again. Go ahead and take a deep breath. Good, everything in my hands is symmetrical. Let me go ahead and take a listen to your lungs here. Just taking a deep breath whenever I move my stethoscope. And if breast tissue were to get in the way, I would have the patient move their breasts themselves so I could get a good listen. Very good. I'm going to do the tactile fremitus assessment again. Just say 99.
99. 99. 99. 99.
Still feel that vibration, which is good.
99.
And then I'm going to percuss here. Again, assessing for that resonant sound. Okay, very good. Let me feel your radial pulses. Good, and squeeze my fingers. Good. I'm looking at your nails, nail beds right now. Good, healthy, non-brittle, good color nails. I'm also assessing for cap refill, making sure I see that blanch, and then that refill within 3 seconds there. Good. We're just gonna do range of, well, let me assess your joints first. First, I'm gonna inspect. I don't see any redness or joint swelling or any deformities. I'm gonna just palpate along your joints, making sure there isn't any tenderness or pain or any deformities that I can feel. I'm just gonna kind of go up your arm. Good, everything feels in line, and I would do it to the other side too and compare. We're gonna do range of motion. Go ahead and stick out your hands there. We're gonna assess the fingers. Go ahead and extend your fingers and flex. Bring them there, and we're going to abduct and adduct. Good, and then for wrists, easy movements, extend and flex. And then level out, and then abduct and adduct. Good. And then for elbow, go ahead and flex and extend. And then we're going to do the supination and pronation rotation. So that is good. That is assessing that elbow. To assess that shoulder, we are going to extend up and flex back like that. Good. And then assess abduction and adduction. We're going to do that internal and rotation test real fast. Go ahead and scratch behind your neck and try to touch your other shoulder. Good. And then of course we would do that other side. Let's see. I think I did. Let me listen to cardiac sounds. I'm going down along where that heart and just listening for S1, S2, making sure there's no murmurs. And then I would switch to the bell of my stethoscope. Very good. This is where we would do the breast exam, which I'll just talk about to the camera. I would have my patient disrobed, and I would note any discoloration, any inflammation, any discharge or drainage around that nipple area. I would look for symmetry and also any dimpling of the breasts, and to see furthering that assessment, I can have my patient put her hands on her hips and behind her head and lean forward and continue to assess those. To do palpation, I would do a spiraling circle to the center there, assessing for any lumps or pain or tenderness. And then go ahead and lay down, and then I would go ahead and I would have my patient lift her arm up, and I would palpate the axillary lymph nodes, looking for any lumps or swollen or pain or tenderness or anything like that. Let's see, I'm going to inspect your abdomen now. The color, I would have my patient show me the skin, which is good at this point. It is a flat stomach, which is good in contour, and it's symmetrical. Let me go ahead, and I also don't see any pulsations or anything like that. I'm going to take a listen in each quadrant, and I'm listening for that gurgling and tinkling sound, which is that your intestines doing peristalsis. And you want to hear between 5 and 30 a minute for normal sounds. I'm going to assess the vascular sounds, and I would take the bell and diaphragm of my stethoscope and listen for the aortic artery, which branches off into the iliac and renal arteries. And then I would just flip it to the bell and just listen. Good, and I can listen to the femoral artery, make sure there's no bruise or anything. Good. I'm going to listen for any hepatic rubs up here. I would insinuate enlarged liver. I'm going to listen to any splenic friction rubs for enlarged spleen, which I do not hear. Very good. I am going to percuss your abdomen. I want to hear a nice tympanic drum sound. I'm going to do that in each quadrant. Very good. And then I'm going to find your liver border. What I'm going to do is go by the umbilicus and percuss until I hear a dull sound, and I would mark where that is, and then I can go up here, making sure to go in the intercostal spaces, making sure that resonant sound is heard until I hear a dull sound, which would also be your liver border, and normal is between 4 and 7 centimeters. Let's see, for spleen, I would find that 10th rib, which the bottom rib is the 12th, and count up accordingly. And then hear that kind of dull sound, and when you inhale, I would hear a more tympanic sound. Good, you can relax now, and so that would mean for a healthy spleen. I'm going to lightly palpate your stomach, any tenderness or anything with that. The stomach is nice and soft there. I'm going to assess your quadrant here more in depthly with deep palpation. And up in this right upper quadrant, I am feeling that gallbladder and liver, and I can kind of push up to feel that border, have my patient inhale, and you can kind of feel that liver drop, that liver border drop. Or I can do a hook method and go under ribs here. You can't palpate the spleen, and if you do, it's enlarged. So when I do this, I'm making sure I'm not feeling that enlargement. So so that's good. Down in this right lower quadrant is mostly bowel and of course the appendix. And then this left lower one is mainly colon, which some tenderness is okay. Very good. I'm going to feel your inguinal nodes and femoral pulse. I'm going to do some hip range of motion. Right now I'm feeling, let me feel here, I don't feel anything abnormal. Nothing sticks out, no bumps or anything. Let's flex. Go ahead and keep your legs straight. Good. And then flip on your side there, and we're just gonna do the hip extension. Good. And then abduction. Good. And then go back on your back. And then kind of that adduction. Good. We're gonna do that internal and external rotation. Any pain or anything? I'm not feeling any crepitus. And then I would do the same thing to the other side. I am looking at the skin here. I'm looking for any swelling, which nothing's pitting as I am doing that. I go ahead and push on my hands and pull back. Go ahead and push up on with my hands and push down. Good. So strength. Whew. Strength is good. I can feel the popliteal pulse by kind of cupping my hands back here behind the knee, and then that tibial pulse and pedal pulse. I would also assess for that nail bed, nice and healthy nails, and the cap refill, making sure I see that blanching and refill within 3 seconds. Let me see. Go ahead and dangle on the side of the bed here. I'm going to look at your knees here. Kind of palpate your joints down here too. Good. I want you to do some more range of motion for me. Go ahead and extend and flex and do that adduct and abduct motion. For feet, go ahead and just give me a full turn of that. Good. That's assessing all the range of motion of the foot, the flexion and the extension, and then there we go, the internal and external rotation. Now I'm going to have you close your eyes, and I'm going to do a sensation test. I just want you to tell me if I am touching left, right, or both.
Left, right, both, both, right, left.
Good. I'm going to take a Q-tip with a soft and hard end, and I just want you to tell me if you're feeling the sharp end or the soft, okay? And just keep your eyes closed through that.
But it's not soft. Soft. Okay. Soft. Rough. Rough. Soft. 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 Rough. Rough. Soft. Soft. Rough. Rough.
Very good. I am going to have you do a finger nose test. I want you to just touch your nose and then touch my finger, and I'm just going to move it in all different directions. Yep. Very good. We're going to do deep tendon reflexes. I don't have a hammer, so I'm going to use this. Basically, I'm going to test your brachial. I'm going to hit my thumb, and basically I should see your fingers twitch. Very good. Brachial, kind of same thing. Very good. This is your tricep. I'm just going to let you dangle there. Sorry. very good. And yeah, I should be able to feel twitching here in that tricep area. I'm going to do the patella. Very good. And the Achilles heel, which when I do that, I should feel, or I should see that reflex. Very good. I'm gonna do the Babinski reflex. I'm going to go along the outer. Good. What I did was go on the outer line of the foot and across the balls, and you saw that normal response where her foot flexed. Let's see. Go ahead and stand up for me. I want you to close your eyes. This is a Romberg test. I am assessing for any balance issues, and I would have her close her eyes for 20 seconds for a full assessment. So there's no swaying or anything or falling over with that. Go ahead and walk across the room for me. I'm just gonna observe your gait, making sure everything is even, and turn around, and I'm gonna watch your front here. Very good. Go ahead and stand in front of me and turn this way. Go ahead and kind of bend over. I'm assessing her spinal column, making sure there's no curvature or anything, or any vertebrae that is out of line. And then I can also assess her hip alignment to assess for limb length there. So, okay, so go ahead and sit back down. This is the point where I would do a genital exam. For males, I would have them standing up, and I would palpate along those inguinal lines and along the scrotum and along that penis, and looking at it, I would look for any lumps or anything, any drainage or discharge, pain or tenderness. And then I could also have the rest of the assessment of them laying down to do the rest of that palpation if it's more comfortable for them. And then I would end with a rectal exam by slightly kind of hooking my finger, not poking, because that does not allow for relaxation of that sphincter. But I would observe that, making sure that everything is smooth and that there's no lumps, and around where that prostate is, that it is not enlarged. I can also observe around the anus, making sure there's no like hemorrhoids or bleeding, and then as I pull my hand out, I would have stool. I would assess any stool characteristics on my glove. For females, I would have them scoot at the end of the table in the lithotomy position, and I would inspect my outer structures first, so like the labia, clitoris, urethra, the vagina, the perineum, and the anus. And then I would also palpate each structure, looking for any abnormalities, palpate the inside of the vagina, and then get my instruments like the speculum to look on the internal structures, like the inside vaginal wall and that cervix, and end with the rectal exam. Just mine, I wouldn't examine for a prostate. So, Tanisha, thank you very much. And I look forward to seeing you at your next wellness exam.
Thank you, Chloe.